I'm Jason Wagner. I'm a surgeon at Sarasota Vascular Specialists. People often ask, what is a dialysis access and what does it take to manage it or to have one? Well, first off, you have to decide you're talking about hemodialysis, meaning interacting with the blood, or peritoneal dialysis, meaning you're using the abdomen. With peritoneal dialysis, it's a catheter that's placed in the belly, and through that, the kidney doctor writes a prescription to put fluid in the belly. Your body balances out your electrolytes and the fluid against the fluid that's put in your abdomen, and that exchanges several times overnight with the help of a machine. When you wake up in the morning, you unhook. So management of that type of an access involves going to the hospital, going under anesthesia or sedation, having the catheter placed into the abdomen, and then having it able to be used. The care of that long term is going to be about sterile technique and things that your dialysis unit will teach you how to do as far as hooking up and unhooking from the system. But it's all going to be about exit site care, where that catheter exits your belly, by taking good care of that, and then being aware of signs and symptoms of infection such as redness, pain, swelling, or discharge. When it comes to hemodialysis access, we're talking about a way of getting blood out of your body, getting it to a machine to wash the blood at a dialysis unit or at home if you're doing home hemodialysis, and then a way of getting that safely back into your body. Often we're going to do that by way of a fistula or a graft, and that's going to be a connection between an artery and a vein, ideally in your non-dominant arm. So if you're right-handed, it's going to be your left arm. With that, we're going to connect the vein to the artery. We usually do that as a small surgery or a procedure. We even sometimes do it, it's a minimally invasive thing, just using needle pokes. Create that connection between the artery and the vein. The vein will dilate over time to be big enough to accept two needles. One's going to send blood to the dialysis machine to wash the blood, the other's going to bring it back. If you don't have a good vein for a fistula to be created, we can connect the artery to a vein higher up in the arm using an artificial vein. That's called a graft. If we do a fistula, it takes about 1.5 months to 2 months for that dialysis access, that connection between the artery and the vein and that matured vein, to be able to be used with the needles. A graft takes about 3 weeks. They each have their pluses and minuses. Certain fistula procedures take actually 2 procedures to create. Grafts are usually a one-time operation, but there are slightly more follow-up procedures required for grafts, just because it's this artificial thing in your body that your body sometimes tries to reject, particularly where the graft is sewn to the vein. The good news is that almost all the procedures we do to help maintain and keep a graft or a fistula open are easily done in an outpatient procedure under local anesthesia or light sedation. It's a same-day kind of procedure. With any kind of hemodialysis access or peritoneal dialysis access surgery, those are usually done as a same-day surgery procedure. Long-term management for hemodialysis access is going to often be followed with ultrasounds. We don't do anything invasive or any kind of intervention unless we absolutely have to. But the signs or symptoms of somebody having a problem with their hemodialysis access, being their fistula or their graft in their arm, or sometimes in their leg, is going to be swelling of the arm or leg, pain, redness, signs of infection. If they're having prolonged bleeding after the needles are taken out, and that's usually a sign of a blockage higher up in the chest or higher up in the arm, or if they're not getting enough clearance, meaning that as the blood is getting to the machine and coming back, that it's either recirculating and washing the same blood over and over again, or it's not getting enough blood through the dialysis fistula or graft fast enough. The nice thing is you don't have to worry about the specifics. In our practice, we'll take very close attention to this and we care for this. We have a very good organized protocol pathway to make sure that people are maintained appropriately, and then we can make all of the fistulas and grafts stay open for as long as possible. And we have a good algorithm, if people have a problem with their access, to get them in right away, to treat them, to get them back to dialysis either the same day or the next day.